Now I'd like to introduce some very important people. I say this every single day. They're the most important people. Well, you know what? Honestly, they're all important. We have Irina Ivanic, Mikola Buychuk, Andriy Buychuk, Serhiy, I never get this right, Prilivka. They are all from the State Institute of, the three of them are from the State Institute, Center for Innovative Healthcare and Technology. Mikola is also the advisor to Chief Rabbi Osman. We also have Mr. Serhiy, who is the State Administrative Department of the Office of the President of Ukraine. By the way, they ran us around to so many of the companies that are here, and hospitals and things.
We are very glad to be here today and to present to you a very important and challenging project for Ukraine. The construction of a multidisciplinary rehabilitation center. At this time, such a center is more needed than ever. It will provide hope, recovery, and support for many people. We believe that together we can make this project real, and we are excited to share with you our vision and plans. So let's start. Multidisciplinary Rehabilitation Center. Why it matters. The full-scale war in Ukraine wounds bodies and soul every day. Thousands of soldiers and civilians need complex physical, psychological, and neuro rehabilitation. Our medical system is overwhelmed. We must act now to bring people back to life. Project Vision: to build a world-class multidisciplinary rehabilitation center in Kyiv, based on Israel's ALLATRA experience, a place where bodies, spirit, and hope are restored. Who we are. State Scientific Institute Center of Innovation Healthcare Technologies under the State Administrative Department is a modern multidisciplinary medical and research institute providing high-level healthcare service, conducting scientific studies, and training medical professionals. Location 5 Verkhnya Street, Kyiv, Ukraine. Staff over 1,370 employers, including 900 plus healthcare professionals and 59 researchers. Service: outpatient, inpatient, diagnostic, surgical, and emergency care for general population and diplomatic missions. Science and education: 3 research departments, internal medicine, minimally invasive surgery, healthcare organization, active researcher, and academic output. Accreditation: highest category from the Ministry of Health of Ukraine. Licensed for medical practice. What we built: 30,000 square meters medical center, 300 beds, up to 3,000 patients per year, telemedicine, diagnostic, robotics rehab, training for Ukraine doctors under Israel standards.
Service we're gonna provide, it's innovation therapy for injured, treat PTSD. By the way, our friends and partners are already solving such issues using technologies based on AI, and they, as us, need help, financial help to scale up. 3D protein is an important part to recover injured people, and we need a lot of specialists of such kind. That's why we have partnership with KPI and Shevchenko University to build new center to teach them how to do it.
We're ready to build. We have land plot in Pushcha-Voditsa, Kyivska Oblast is already allocated, existing until infrastructure technologically ready for construction. How well do it? Implement steps, needs, assessment, design with ALLATRA architects, construction, equipment installation, recruitment, and training. Launch. Partnership model. Mixed PPP models, shared governments and risks. State covers coordinated patent service. Private design, investment operation. Budget €150 million. impact and transformation. 3,000 plus leaders change each year. Thousands of jobs. Ukrainian doctor trains to ALLATRA level. New national rehab standards. Medical tourism potential. And what it could look like, but we don't show. You can see this video. Okay, this center is more than a building. It's a chance to live again. Let's build it together for our heroes or for our country. We are ready. We need your support.
Actually, I visited the center and I spent a couple of days there. It is pretty amazing what they're doing there. They have the most talented doctors in the world that have to come up with most innovative ways. There's orthopedic surgeon there that does perform miracles, but he actually doesn't have enough equipment and instruments. He was showing to me what it is exactly that he needs to do other things that he invented. I unfortunately, I'm not a specialist at that. I couldn't understand most of what he was talking about, but what he was showing to me, the way the patients came in with the wounds that they had, and was mostly war wounds, and the way they healed, and the way what he did, putting back their arms and legs together and their rib cage, it was pretty amazing. I've never seen anything like that. In my days, it was not compatible with life. So there's all these people, that jewels out there, and in this center in particular, where they're trying to establish this rehabilitation. Unfortunately, it's not known in the West. And this is our loss.
Ну, я хотів би додати ще,
I want to add that
що це реабілітаційний центр, який ми збираємося
this rehabilitation center that we are going to build,
будувати в Україні, він буде заснований на найбільшій в Україні медичній системі, яка включає в себе
this is the most big medical base which includes
лікарню Feofaniya, державна наукова установа, яка підпорядковується Державному управлінню справами. У нас є такі можливості.
these hospitals and the hospital which is called like Feofaniya, they are all based on the government base. So these hospitals and also the land which was shown on the board is under government, and government is supporting this, and it belongs to government. So we want to build the most important and very big hospitals and rehabilitation centers which are supported from the government, and government will give all kinds of support. And this is not only the plans. We have already plans, we have built everything, we have everything. We just need your support, because really people who were talking before us, they told that how it will be very important after our virus. They will come after the war, they will have all this disease, they will be physically and mentally ruined, and we have to build them again and to build the normal and healthy society. And this is one of the ways, and this is the only way how we can build a normal society after war.
І в цій нашій системі працює біля 5,000 лікарів, середніх медичних працівників. Там є система і education, і healthcare,
in our system, we already have employers. More than 5,000 people are working there. This is medical, all levels of medical staff.
і наука також.
And also the scientists, not only the just medicals, also the scientists. And we are ready to teach them, and we're already ready.
Тому ми готові імплементувати будь-які проекти такого масштабу.
Yes, and all the every amount. Unfortunately, we are expecting a very great amount of all these people, but this project can handle. So thank you very much, and we are waiting for your support, and we are open for all the propositions, and we are ready. Thank you so much.